Welcome. I'm Suzanne Troop, and I'm a board certified obstetrician gynecologist, owner of Hatha Yoga and Fitness. I practice gynecology. I've had over 40 years of experience in the realm of this topic, including many clinical research topics on this as well. And I'm pleased to tell you that we will be offering other material that will dig very deeply into several of these slides. But in a 60-minute lecture, we're not going to be able to cover this topic exhaustively, and you will see slides that contain a little bit more content than I'll have time to go into. But I thank you for joining and hope that you enjoy our material. I am a certified continuing education provider through Yoga Alliance. If you're a yoga teacher that needs continuing education and have watched this material, contact me directly or through the Yoga Alliance education portal, and I will issue you a certificate so you can claim your credits. The point is to discuss menstrual wellness and some of the research in both yoga and meditation and breath work, and in fact, exercise physiology that will help us understand this topic. As I said, all the different sections will be presented in subsequent lectures, and I welcome you to submit some questions to me for topics that you would like to see delved into a little bit more deeply, but my initial intent was to educate the practitioners of yoga and the teachers of yoga on safety and wellness issues for menstrual cycle health. I'd like everyone to understand some of the nutritional heat issues, exercise issues that impact this as well, and having a little bit more basic understanding of menstrual cycle hormones. So, again, a lot to cover. We do feel that the benefits of yoga will extend to all menstrual cycle components. So, all the different phases, all the aspects of our physiology, our blood flow in our pelvis, our pelvic floor health, our mental health, some of the ability to stabilize our hormones. So we're going to touch on all of this. I think there are specific benefits to therapeutic regimens. I do practice medicine, and I will be touching briefly on some of those topics, but specifically, this is not a lecture intended to treat or diagnose any particular person or complication. I do think that practicing yoga gives you overall benefits to your fitness, your exercise physiology that extend far beyond the menstrual cycle. I do feel that the literature backs up that practicing yoga releases stress, combating physiology, decreases those immune modulators of our stress responses, and decreases those negative inflammatory effects from too much stress. We can definitely show that there's overall improvements in quality of life when you practice yoga during the menstrual cycle, and yoga positively impacts all sorts of our interactions. But see your own provider if you do have questions, of course. So first was safety, first and foremost. When we enter a room to help our yogis practice, we always try to maximize safety. And of course, I'm here to tell you that yoga is safe to practice during your menstrual cycle. For some reason, I even hear quips and quotes on TV programs that I'm watching about inversions and so forth, and many myths have been uh, proposed during or perpetuated about yoga and menstrual cycle health. As late as in 2007, you could still see publications that were very reliable that still talked about yoga not being safe to practice during inversions. And this is not accurate. There is something called retrograde menstruation. So most menstrual cycle flow comes from the lining of the uterus through the cervical canal and into the vagina, which is what we perceive as our menstrual flow. Some of that flow goes down the fallopian tubes, makes its way into our pelvis, and literally 90% of women have had this retrograde flow, and it is not harmful. If we were able to study the fluid that is free in our abdomen, the peritoneal fluid, we would show that menstrual cells do wind up in our peritoneal fluid. This fluid is always moving. That's why our insides don't stick together. And for most of us, it moves clockwise, which is pretty interesting, but it probably has to do with where the ligaments align, holding our gut into place. The tubes themselves and the cervix themselves maintain a specific tone, and whether you're lying down in bed or standing on your head or doing a down dog pose, that cervical tone is not going to change very much. There's specific pelvic lymph flow, there's specific pelvic blood flow, and all of that will impact on the menstrual cycle itself, how much blood you see. Very dehydrated people may not bleed as much, but that doesn't mean that's good for you and or a strategy that we should employ. Back to the topic of overall safety. It's safe to practice yoga. It's safe to practice fitness regimens, but both have some risks. Most of what's been studied in terms of safety in yoga has studied breath work or pranayama practices, hatha type yoga. So, not necessarily as much with the flow, but the holding of those poses or moving from one pose to the next. And of course Bikram, which is practiced in high heat and high humidity. And most of the adverse incidents are really when we practice by ourselves. So I know I'm giving this lecture online. It's very useful to have some online interaction in our life, in exercise life as well, but it's safest to practice with a teacher present. And the most risky postures are always going to be headstands, shoulder stands, intense lotus if you're not prepped to get into that position, and some of the forceful breathing techniques. At Hatha, we have a free online pranayama course, and we haven't yet posted as of the recording of this lecture on some of the more forceful breathing techniques, but I urge you to practice those safer pranayama breath work, whether or not you're anywhere in your menstrual cycle. We think that most of the injuries, whether you're on your menstrual cycle or not, affect the musculoskeletal system. About a fifth of actually have affected the nervous system, like an actual nerve, impingement, entrapment, stretching, and 12% of the injuries reported are from eye. And in the literature, about three-fourths have 100% recovery. The literature's not real precise, and most of the studies that I read didn't go into a lot of detail or get really good comprehensive diagnosis, monitoring, and follow-up. Pre-existing conditions like osteoporosis are the most I would go with risky to practicing yoga, but it's not going to be common in somebody actually still having menstrual cycles. Same with the eye condition of glaucoma. That's going to be more relevant to those practicing during menopause. And I'll just give myself a little preview here. We will have discussions on menopause and yoga coming up. But just in general, yoga injury rates similar to injuries seen in other exercise programs. And that's not going to change whether or not you exercise during the menstrual cycle. Subtle body health and menstrual cycle is really important in the practice of yoga. It is the area of yoga that I have the least experience, but I would want to touch on a few things. So, interestingly, it's the Hindu medical literature that has the oldest known description of fallopian tubes. And I think that in and of itself shows how old the actual science of yoga is, not just the practice, not just the mental benefits, not just the ethical, and some might say spiritual religious practices, but the actual science behind yoga dates back very, very long. And yet we know that some of the science, the literature of yoga still many years ago was excluding of women and not mentioning women. When we read Patanjali's principles, you don't find much that would relate to an actual menstrual cycle, and anything that is more conceptual, like even birthing, is more dealing with cyclical lives rather than a female with her hormonal status functioning in the yoga world. Um, Ayurveda is a sister science. It comes from the Indian traditions, and there's quite a bit in this literature about your three doshas and your menstrual cycle wellness. In terms of our subtle body, we think a lot of this relates to inflammatory immunoglobulin health. And that's how we merge us in science with those in the spiritual realms. So we think that, for instance, these immunoglobulins, which protect us against toxins, disease, aging, sun damage, all will change as we practice yoga, including the IgAs, which are found even in our mouth. Just our breath work will change our immune status. And we're starting to look at how that might change relative to hormonal health, relative to times in the menstrual cycle. So that's a little bit of a teaser that more information is in fact coming. I think of flow as a time of renewal for yogis, and I will hope that you will too. I'm going to digress a little bit to talk about the support of yoga practices for those in the LGBTQ realm of life. And there, again, we do think males and females will have different fluid responses to exercise. So, in our blog post, we talk a little bit about sweating, a little bit about hormonal health in general, and you can find some of that information there, specifically with response to what you need in terms of replenishment. That's going to be important. And how that overall changes with different poses. But of course, our fitness level is important. So it's not just our age, it's not just where we are in our menstrual cycle, but it's how fit we are. And that's going to be true for menstrual health wellness. there are hormones that we don't really think of, our traditional hormones. If I said to you hormonal health, of course, the word estrogen is going to pop in your brain. If I tell you menstrual cycle, the word progesterone is probably going to pop in your brain. For those who are a little more sophisticated about what hormones change, you might think about testosterone, but it's those kidney hormones, our renin activity, our aldosterone, our vasopressin, that will actually modulate our response to fluid changes, and those um, those hormones are more responsible for how well we hydrate, how well we recover post, uh, say, a hot class, and that will vary during the menstrual cycle, as I will come back to. Okay, back to LGBTQ. I know a lot of these topics are very interrelated, and it's hard to know what order to present this material in because it's a big topic. So, in general, we try to avoid those heteronormative statements. We do think that uh, we need to take a step back as a healthcare provider for a moment, not just a yogi teacher, and talk about normalizing behaviors with respect to your cycle. So, for some people, it's very important to cycle. For other people, it's very important to avoid those cycles. So, we know we can use hormonal management to either bring on regular cycles for those who don't have them, or conversely, in those with regular cycles, take them away. We talk about gender dysphoria, and this extends into the menstrual cycle as a stressor or discomfort that can occur when your biological sex and gender identities aren't really aligned. So, important to realize when we dig into these topics more deeply in the future, we might be also talking about trauma. In general, quickly, hormonal therapy remains a very central aspect of any medical management for various individuals. So, in sort of broad strokes, transgender men use testosterone therapy and suppress ovulation. Not everyone. Some transgender men want to get pregnant, want those cycles. So, again, as a healthcare provider, we have to help individuals achieve their personal goals. Transgender women will suppress testosterone and often need estrogen supplementation. So we know that these treatments take a while to take effect, and in individuals who have a functioning uterus and functioning ovaries, it may take a little bit of time to achieve these hormonal strategies. But mindfulness always helps. Mindfulness is always going to be part of our yoga practice, whether it's at a time during the menstrual cycle or not. And mindfulness will also help adhere to treatments because of these treatments that I mentioned in the prior slide. It is very important to be consistent or the goals are not achieved. Okay, the moon. Big topic, one of my favorite topics. We do respond to the moon, all of us. And when we're talking about moon practice, when we say third eye, the yogis often mean a certain limb of Ashtanga practice or a certain set of individual chakra or several chakras, but in medicine, we mean the pineal gland. This is a fascinating gland that produces melatonin and some tryptophan, and it is a way that we control biologic rhythms. And of course, our menstrual cycle is an important biological rhythm. We think that the moon has dramatic effects on human behavior. We can see that birth rates, hospital admissions, reported diseases all change with respect to the moon. And this is true in many ethnicities and many medical traditions, not just ours. In one Swedish study that looked at individuals between age 16 and 25, we found that approximately a third of menstruations occurred around new moon. And the mediating factors seem to be when melatonin peaks. And in fact, our melatonin production does peak mid menstrual cycle. So when I say mid menstrual cycle, we count day one as first day you see any bleeding. We go until the last day before that day one. So the last day of the menstrual cycle usually is that last day. So in a 28-day cycle, ovulation should occur right around day 13, 14. We'll be getting into this again. So, and that is the day, in fact, that we would be ovulating if we're not suppressing ovulation, and melatonin production does increase at that time. So if you then begin your onset at a darker time of the moon, there's other physiologic changes that do occur. Again, one of these slides that we can spend an entire hour on, but this has a few illustrations from an article in Frontiers in Neuroscience that was published back in 2022, and it does show that there are different female brain changes in response to the menstrual cycle, and in fact, estrogen levels seem to control the left brain. Estrogen levels also will change our gray and white matter, so that white matter is the substance of our brain. Gray is the areas around that brain substance. And I would be remiss if I didn't mention some actual yoga poses in this talk. And I'm not going to get into what a moon salutation is, but I hope that in some of our vinyasa classes, you'll get exposed to those. Or if you're a yoga teacher, you're probably pretty familiar with this long held sequence. So very often we nickname this sun, sea, or maneuvers or classic salutations. And of course, now we vary these quite a bit. Okay, so what is chronobiology? It is the whole topic of various rhythms. So everybody's pretty familiar with circadian rhythms. So day in, day out, 24-hour cycle. And we do find that that's a very nice time to practice sun salutations. There are other rhythms that are longer and shorter than 24 hours. We think that yoga will regulate testosterone and growth hormone uh, secretion and affect our hormonal cycles that are much shorter than 24 hours. Some of these have regular pulses within the hour. And this is why even a midday, 10-minute break, whether you're on your menstrual cycle or not, can actually affect these hormones that are so important to the menstrual cycle. And we have something called greater than 24 hours cycles, and this is where the menstrual cycle lives, of course, and why we then looked at different practices at different times of the cycle to affect or benefit this menstrual cycle. Um, there are many ways we can affect these things. Some have to do with our mental state, some have to do with regular practice, some have to do with sleep, nutrition, hydration. Big topic. Menstrual cycle and exercise physiology. Okay, we're going to get a little more deep into the menstrual cycle, away from just topics that are a little bit more broad. So I think as we dig into these things, we will in fact be able to understand how our yoga practices positively influence these concepts. It's the modern world. I'm wearing a wearable at the moment. I don't make as much use of it. Don't have menstrual cycles anymore. However, wearables are common, beneficial, and can help you understand your sleep and rest. And if there's no other good use of a wearable but increasing your stress reduction or decreasing your stress, uh, increasing sleep, increasing uh, just overall rest during the menstrual cycle is important. But also, for our purposes of this lecture, we need to understand that the menstrual cycle tracking can predict when you're going to ovulate. It can monitor your overall reproductive health. It can offer some recovery suggestions, some heart rate variability suggestions, and be fairly interesting as terms of tracking your heart rate variability, because people will notice trends relative to the menstrual cycle. I list a lot of common ones here. And if you're going to not necessarily use a wearable, just a tracking app, there's so many out there, but Flow and Clue are probably two of the most popular menstrual cycle trackers. What hormones are we talking about in this lecture when we talk about what hormones and how our practice can affect our wellness? Well, we're making these hormones in our ovary, our adrenal gland, our thyroid, our pituitary, our pancreas, and our pineal gland. In truth, the brain even produces little bits. The brain produces a little bit of testosterone, little bit of testosterone's produced in the liver. Quite a bit of our testosterone, probably a fourth, is actually produced in our adipose tissue, our fat. So I urge you to realize that these are generalizations. We're introducing concepts that will hopefully lead to deeper understanding as we progress through this talk and others. The hormones that I'm going to mostly be focusing on, we've touched base on them already, are estrogen, progesterone, androgens, testosterone being the main androgen for women, prolactin, one of our brain hormones, insulin, produced by the pancreas, and melatonin, produced by the third eye. An ovary. So early in that menstrual cycle, day one, we have a follicle. I should back up and say that we develop these follicles in fetal life. In fetal life, we'll have something like 4 to 7 million of these follicles. Most die during fetal life. When we're born, we will have somewhere between 1 and 2 million follicles, most likely. And we only ovulate about 400 eggs in our entire life. So the destiny of most of our eggs and follicles is cellular death. And trying to understand why that is and why we have uh, such a reservoir that we don't use is something that we're trying to understand, but we don't really grow new ones. That's why it's so important to be healthy during your menstrual cycle, because we need to take care of our eggs. We're not getting more, we're just waking up some of what's left. And here's a sequence from the follicle developing to release to developing a mature egg that could be fertilized to become a pregnancy, or um, it's just released and not fertilized, in which case that same follicle then turns into a corpus luteum, and then that corpus luteum eventually dies off and no longer produces hormones. There's another way of looking at that sequence and the levels of hormones in that theoretical 28-day cycle. And you see that estrogen levels will rise from very low early in the cycle to higher. Our estrogen levels drop down in the early third week of that cycle, have another peak, and we repeat this process. There is a temporary big estrogen surge as you release uh, your egg to ovulate. It, just before that, in um, a normal menstrual cycle, progesterone is very low early in the cycle, and progesterone peaks around that third week of the menstrual cycle. And it's that progesterone peak that starts to prepare the lining of the uterus, which we see on the bottom of that slide. So our uterine lining starts out fairly thin. It develops more glands. It gets both thicker and a different character, a character that's welcoming for an egg to implant in the third week. And if we're not pregnant, it sheds down to its basal layer. Our temperature does change during the menstrual cycle in response to that progesterone. So people who are not ovulating regularly won't have as much temperature shifts, but those that are will get as high as almost a couple of degrees Fahrenheit in that thermogenic luteal phase of the cycle. You can track that with one of your wearables, or you can track that on an app, or with a thermometer. The uterus itself does produce some hormones. There are some studies of hormone production by the uterus itself in response to yoga practice and in response to the menstrual cycle. And we're not going to be able to cover that today. I want to say something about the concept of bloating. So, abdominal swelling, bloating means gas. So, this is really, when it comes to the menstrual cycle, many women will report late in their cycle and during menses this bloating. It's usually a sensation. It's not usually something that we can visibly see as a distension. We do think that there is a little bit of slowed gut mobility, and this may in fact be due to certain food changes. We think that it can lead to both psychological distress as well as some functional changes, and it might be accompanied by actually passing gas, and we do a lot of wind relieving poses during the late menstrual cycle, and during the menstrual cycle it can feel pretty good. And it is in fact due to hormonal fluctuations with the menstrual cycle, those changes specifically that I showed in those the graphs in the slide before. Water retention bloating, again, a little bit different. We have tried to do accurate studies of this water retention. Many women will say, hey, my ring doesn't fit when I'm premenstrual or early on my menses, but trying to actually get research studies that back up actual changes in our water retention, our swelling, has been very difficult. We do think that it's a response from estrogen progesterone changes during the menstrual cycle, but it's very difficult to actually document. So, in general, fluid retention during your menstrual cycle is going to be very individualized, and your response to yoga and yoga practice during this time is going to be very individualized. Although we think that it has something to do with estrogen and progesterone, if we try to compare a woman with a lot of fluid retention to a woman without a lot of fluid retention, or compare a woman as her own control in one cycle versus the other in terms of fluid retention, we can't really do a one-to-one correlation between our hormone levels and fluid retention. One thing as we get a little bit later, I have two slides at the end that mention early and late menstrual cycles, but as we get a little bit later into the discussion, I will mention menopause, but suffice it to say, in perimenopause, where we're more estrogen dominant than progesterone dominant, people report a little greater fluid retention. But to document this, or if you went to your doc and said, hey, give me that test that tells me how much fluid I'm retaining during different times of my menstrual cycle. Sorry, we can't do that. I wish we could. I really wish we could. Um, and fluid retention and those temperature changes don't seem to correlate very much either. So some people have big temperature shifts without much in the way of fluid shifts, and others vice versa. And therefore, really have to know yourself whether or not you can use this information to guide. Do I practice in the heat today? Do I practice a certain way today? I think that's overstepping what we really know from science. Okay, I could give hours worth of lectures. Just throw this slide up. So what we were talking about, there are changes in the hormone levels. There are changes in our brain function. There are changes in our uterus. Specifically, there are changes in our endometrium, that lining tissue of the uterus. And once that lining tissue breaks down, we're releasing all these phospholipids and affecting our arachidonic acid and other factors that lead to menstrual cycle pain, discomfort, some of the bloating, some of the effects on the GI tract. Some people, it translates into various forms of bowel changes, more commonly to be diarrhea than anything. But this cascade of hormonal changes during your menstrual cycle has to do with pain. And yes, yoga can affect this cascade and improve the flow such that we produce less of these pain producing chemicals. All right, so what about our fluid balance? This is uh, the the same slide that I threw up from before. And just to remind me to tell you that from these, we think that if you practice a lot in hot yoga, you're going to have a different set of responses than if you never practice hot yoga. It's a little bit of a shout out to say that we do think that the infrared heat that we have in our yoga studio is not only beneficial for joints, but beneficial for the practice during menstrual cycle as well. Okay, what about um, changes in our sleep, changes in use of supplements, changes in our diet, and how that can affect our yoga practice during various times of the menstrual cycle? lots of interesting data out there to go over in subsequent lectures. As I mentioned, during our luteal phase, that second half of the menstrual cycle, for most people, that's going to be the most consistent. So I think I mentioned that most of us will more consistently have 28-day cycles. And in fact, anything from 21 to 35 is considered normal. If you have a 21-day cycle, you're probably ovulating very early, like day 7, 8, or 9. And it's that luteal phase that's generally going to be 12 to 14 days. If you have a 35-day cycle, it's that luteal phase is going to be that last of 12 to 14 days, and ovulation in somebody that has regular 35-day cycles is more likely to be around day 20, 21, 22, something like that. Um, so, good time for contraceptive protection, good time to conceive. If you're trying to use your yoga practice to normalize ovulation to help conception. Melatonin production uh, actually decreases our body temperature a little bit. It has to do with when we get our best sleep. We gotta drop that body temperature a little bit. That's why it's best to sleep in a slightly cool room, no matter when you are or where you are in your menstrual cycle. Um, in our luteal phase, cognitive performance is a little bit better. We do think that our sleep patterns will vary depending on the time of our menstrual cycle. So, for some people, different times of their cycle are going to translate into worse sleep, and that may affect how you plan your exercises. Maybe it's time to do a restorative class, not necessarily as much power. And on the flip side, some of us just really need that endorphin boost that power classes are going to get, that also may vary at different times of the menstrual cycle. But anyway, some people have a little less REM noted in during their menstrual phase, their their late luteal phase, and actually naps even change in the amount of restfulness and REM that you get during your menstrual cycle. So uh, there's another interesting use of tracking your cycle and your wearable, understanding how your naps and your sleep and your REM patterns change during the menstrual cycle. Okay, we do think that performance, whether or not you become very fit, whether you recover well, all are affected by our ovarian hormones. So, coaches and athletes of all different disciplines have tried to use this information. Um, we do know that we sweat more and we shiver more in response to heat and cooling on different times of the menstrual cycle. And we will be delving into this in future talks as well. Okay, what's phase cycle? So, phase cycle or cycle syncing can mean lots of different things. For some people, it's just how they eat relative to their menstrual cycle. And a lot of my weight loss clients have used this fairly effectively. For others, it's syncing your workouts or your yoga practice. And again, what I was saying before, certain times of the month may be better for power yoga, certain times of the month may be better for grounded restorative practices, and it may vary from person to person because our hormone levels vary from person to person. And during our teen years when things aren't as regular, and our perimenopausal years when cycles are more disruptive, these practices will in fact change. And just going back to that timing, which I haven't had a lot of time to discuss, in today's lecture. We still have a lot to cover, and but the you can see listed here. You can put on pause and read this slide if you'd like, the different days. So we do think that physiology, kinesiology studies, sports medicine studies show that we have some different relaxation and muscle function patterns with respect to the menstrual cycle. And what exactly yoga's effect on all of this is under current investigation. I'm very excited to see some of the results of this. We do think that exercise and yoga can affect our cortisol levels, our endorphin levels, and our adrenal, our epinephrine and norepinephrine responses. We do think that specifically yoga nidra practices is very helpful in patients that have hormone imbalances. We think that your vitamin and overall metabolism will affect this as well. Okay, pain. We touched on physiologic, why we get some of this pain, but I'm here to tell you that yoga will reduce your cortisol level and will improve your resilience to stress, and that will in turn change your pulsatility of your hormones from higher brain centers and decrease menstrual regularity and give women who practice yoga less PMS. There are different ways to approach this from a Ayurvedic and a Western medicine perspective, and we're not going to be able to dig in today on this, but I do want you to know that this is something that is important to pay attention to. We do think that specifically yoga enhances parasympathetic activity, hence why we feel more calm. So, for those who feel more anxious during their premenstrual time, yoga is one of the best things we can do. We have shown that yoga can benefit our menstrual cycle in many ways. It decreases the pain during menstrual cycles. It decreases the amount of blood we lose. It decreases the amount of medicine that we need to control that pain in those that need medication, and overall, therefore, positively affects our quality of life. We have a meta-analysis of over 16 trials, and yoga benefits pain syndromes other than dysmenorrhea or menstrual pain. Dysmenorrhea is a response to that contraction of the uterus. And so, specifically, our yoga practice will modulate how much that uterus is contracting in response to the flow of blood. We have research that I'm mentioning here, and that basically says that yoga is a very effective intervention for menstrual cycle pain. The most research has been done on cobra, cat, and fish poses. The most research has been done on late teens and early 20s, because that group will have very consistent cycles. As we get into our early 30s, we start crossing over into perimenopause, and that's why some of the research is really missing from that group. I just want to touch on some of the more common gynecologic conditions. Here's a picture of implants of endometriosis. It is a little beyond the scope of our our talk today to talk more about this, but yoga, in fact, can ameliorate the effects of uh, endometriosis, on pain, on fertility. The most of the studies out there were specifically on the use of hatha yoga for endometriosis, or hatha, as many think the correct Sanskrit pronunciation is. And we do think that if we're going to try to relieve pain, focus on those posing and those flows that will uh, improve our lower pelvic area, our diaphragm, our lower back. Here's a picture of the non-cancerous muscle knots that 1 in 3 women get, uterine fibroids. And we know that the uterine fibroids are a common cause of menstrual cycle heaviness and menstrual cycle discomfort, as well as potential impact on fertility. And we think that yoga is important in the treatment of the discomfort for those who have fibroids, but there's some research that says that it's that normalization of hormone health that yoga practice does that will decrease the eventual development of fibroids. So when we have our times when we're trying to address for our clients uh, yoga, the use of yoga, I should say, for dysmenorrhea, we have a focus on very soft movements, a focus on a little bit more of that passive stretch. Power classes, a little bit more of that active stress, so a little bit different there. Um, and we then have like some things that we aim at, and here's just one slide that focuses for you, gives you some suggestions there. Polycystic ovarian syndrome is quite complex. It's present in 1 in 10 women. So you got 10 people in your class, probably at least one of them has PCOS. It can cause a variety of potential side effects, and it actually changes. It's a very exercise and weight sensitive condition, and exercise is always going to be my number one go to for treatment of PCOS, and yoga as part of that exercise program is also going to be an important factor. Now, as people have changes in their menstrual cycle, that's usually correlated with changes in ovulation. So some people have fewer ovulations, i.e., oligo-ovulation. Some people quit ovulating when they have menstrual cycle changes and ovulation, and that is correlated with how mild or severe your polycystic ovarian syndrome is. We do know that there have been many studies showing yoga's benefit on these abnormal cycles uh, in women with PCOS. So we do have science to back up our recommendations of adding yoga to your regimen. What about for PMS? PMS is the mild condition. PMDD is only present in about 3% of women with PMS, and PMS is only present in somewhere between, depending on the study you believe, between 30 and 60% of individuals. And we think that these women have an abnormal response to actually hormone levels that look pretty much like anybody else's. So the principles that apply to normalizing the menstrual cycle with yoga practice would help with these conditions as well. So exercise also helps with PMS. Yoga, however, studies show more benefit than just an exercise program alone, which is why we encourage women with this menstrual cycle disorder to practice yoga. We think that those with PMS have an abnormal response of their pituitary, um, their their hypothalamic higher brain center, pituitary adrenal access the flow of hormones from that signal one gland in response to another. And we know that specifically in people with these kinds of menstrual cycle disorders, regular yoga practice can normalize their immune system, decrease abnormal inflammation, and decrease what and all of these factors, one that we can measure is IL-6, which produces important things in our physiology that can fight off, be part of our defense mechanism when we're fighting illness and so forth. But when it gets too revved up, that defense system fights against ourselves. So we do have studies that look at various parameters of menstrual cycle disorders and pain, and we have shown that this is treatable by regular yoga practice. We also think that work performance improves with regular yoga practice in people with and without PMS. And of course, if our doshas are unbalanced, we're going to have worse PMS. I promised I would circle back a little bit to puberty and menopause. The timing of puberty is multifactorial. Um, it changes wherever you are in the world, which may or may not be based completely on ethnicity. We have noticed that in our Western environment, primarily due to activity levels and diet. Um, Being a little bit heavier, our menstrual cycle onset has been steadily decreasing, but this has been going on since the 1850s. So it's just not something we can blame on our recent obesity epidemics. But we know that it will take 5 to 7 years for cycles to become regular. So a teen in your class is not necessarily going to be responding the way someone a little bit older is. We probably have the start of perimenopause in our late 30s, early 40s. The hormones made by the ovaries, including inhibin, which I'm not going to cover in today's lecture, do change. We start to wake up fewer follicles per menstrual cycle. And so with fewer follicles waking up, sometimes one follicle doesn't even come to fruition. So our follicle development starts to be in the presence of no fertile egg at all. And the effects of these hormones on our circadian rhythm, remember all the way back to that chronobiology, does change, but exactly how that is going to be affected by yoga practice still being worked out. But I will give a whole talk on menopause. So just to summarize a little bit, we've discussed a lot about yoga. We've discussed quite a bit about the uh, basic menstrual cycle physiology. Our goal is to help and support the safe and effective yoga practice during menstrual cycle um, during those that have regular menstrual cycles and during the periods. Um, I just barely touched on the interaction between subtle body and menstrual cycle awareness. That's a whole separate talk on its own. We know that the practice of yoga as it relates to fitness and exercise and hormone balance and pain, it's very interrelated. We didn't talk a lot yet on how athletic performance will change during the menstrual cycle, but I encourage you to follow subsequent lectures in that I will post to my channel and go into this in greater depth. And we did talk about the way trans men and trans women have different approaches to their hormones, which will then affect their menstrual cycles and their response to yoga. Um, but anyway, you can find me teaching at Hatha Yoga and Fitness or join our breathwork class that's free online. Thank you for listening. And I will say this content is the property of Hatha Yoga and Fitness. Um, Duplication or use of this material does need to be requested in writing. I thank you all for participating. Look forward to providing you with more in-depth information on all segments of this talk. Namaste.